Hey, so I'm Tasha Dixon. I am a licensed marriage family therapist, and I am the behavioral health consultant for the TRDRP project. And so today I'm going to talk to you about the effects of group counseling for smoking cessation that we already have began implementation within the LA County clinics. So the current implementation, we have the 12 targeted clinics within LA County and with the Department of Health Services and Department of Mental Health Services. 5 in each of those departments are targeted to provide the smoking cessation groups. And currently, out of those 10 clinics, we have 7 who are up and running the actual groups. The other 3 clinics are trained and are ready to begin those groups. So how we get recruitment and who can attend the groups. So I'll start with who can attend the groups. So any patient of DMH or DHS who smokes cigarettes can attend the groups. Participants who want to quit, as well as participants who are not sure if quitting is for them at this time, are still encouraged to attend the groups. So recruitment happens with our smoking coordinators or study coordinators, as well as the facilitators of the group, excuse me. And so how to join a group for participants is that the clinics that we have targeted that are actually running the groups have flyers set up within the clinics that have contact information to our study coordinators as well as to the facilitators and the time and date of the groups. And recruitment is happening by way of the facilitators as well as our study coordinators. And I'll talk a little bit more about recruitment as I go on. So the group dynamics. So the purpose of the groups is to help or assist smokers to make a significant reduction in their tobacco use on the journey to quitting. So how we go through the groups is to promote reduction on a journey. So we're promoting that you will see, if you're a smoker, you will see that you are reducing as you go along on the journey to quit, because we know that quitting is difficult. We don't expect it to be something that you do automatically and just wake up one day and quit, but we actually walk with you through a journey. The content provided, I'm going to actually switch screens really quickly just to show you some of the content that we use. If I could do this effectively. There it is. So this is our Kick Ash.
No, you have to share. Stop sharing and share again.
Okay.
Thank you. There you go.
Is that better? Okay. So this is our Kick Ash Facilitators Guide Manual. It's a cognitive behavioral approach for smoking cessation groups. This is the curriculum that the facilitators within the clinics are using for the groups. So I'm just going to quickly go over the table of content so that we can get what the content that the participants are actually getting from the groups. So if you see, each one is broken down. So the groups are set up in 6 weeks. So each week, each session is broken down with different guidelines and different topics to address tobacco use and the journey toward it. So we have session 1, Living Tobacco Free, A Dream for a Lifetime. And in this session, we talk about in helping the participants envision what it would be like to not be a smoker, what that looks like for you, what your relationships would be like, what money would be like if you're not spending money on cigarettes, and just what your overall quality of life would be like at this point if you no longer use tobacco. So in this group, we do group rules, we establish just a core group dynamic in those rules, helping each participant, each member of the group come together and understand each other and kind of respect each other in that sense. And then we provide some health facts, information about if you stopped smoking, what it would be like. So everything is about the future of what it would be like if you were to not smoke. So then we go to session 2, embarking on the journey. So this is where the journey begins. We identify triggers in this session. We actually help the participants set goals, and these goals are set on a weekly basis. And the reason for that is because, again, it's a journey. And so we want the goals to be, you know, if I smoke 5 cigarettes a day, I am going to decrease, you know, try to smoke 3 cigarettes a day. So my goal would be to remove 2 of those cigarettes. And in that goal setting, we talk about what time of day do you smoke, kind of helping the participants really look at their smoking behavior and see if there's a pattern. Do you smoke first thing in the morning? Do you smoke on your smoke breaks? Do you smoke right before bed? And kind of see where, if they can identify a pattern of where they smoke or when they smoke. And so in this, we also introduce a cognitive triangle, and we kind of explain how your thoughts and your feelings and your behavior around smoking all go together and all are work together. So if you can alter one of those things, then, you know, you can have, so for instance, if you wake up feeling depressed or feeling sad, then the thought about it would be, I don't want to do anything today, I'm no good, or just in negative thinking happens. And then the behavior would be, you either be more triggered to kind of smoke or triggered to not be productive in the day. So we talk about how if we can change the thinking pattern, then the feelings and the behaviors would follow along and be different as well. And then we also implement some coping strategies in this group, in this session, and to help participants when they are having difficulties in their thoughts, feelings, or behaviors, that they can use some of these coping strategies to put in place. Session 3 is the tobacco-free journey, regulating thoughts. So when we talk about regulating thoughts, we spend a lot of time with the participants talking about what is their thinking when they're smoking or when they get the urge to smoke, what's happening thought process wise. And so we teach thought stopping, we teach reframing thoughts, and then we also talk about how to deal with worrying and just having negative thoughts in general, and how you can actually put some things in place to change those things, change that thinking pattern. Session 4 talks about regulating feelings. So we help participants identify their feelings towards smoking and identify the feelings happening when they are smoking. So again, as participants leave the group for that week, they are more prone to be in tune to these things for that week and come back and be able to say, oh yeah, I was able to identify feelings at this point or at this time. We also talk about happy thoughts and pleasant activities, kind of helping participants identify pleasant activities for them that they can put in place when they get the urge to smoke. So again, each of these groups were also reviewing goals and renewing goals every week so that they move towards the journey. So session 6 session 5 is just number 6. So session 5 is regulating behaviors. So again, we talk about trigger behaviors and implement some alternative behaviors and put them in place. And the alternative behaviors is to smoking. So instead of, if I'm feeling this way, if I'm thinking this way, instead of smoking, what else can I do? So kind of, there's a list, there's a chart of things that they can do if they have certain urges that we actually can give them as a handout in the group. And then we bridge together the cognitive triangle, because already the last 3 groups we've done thoughts, feelings, and behaviors. And so we again introduce we reintroduce that cognitive triangle to show them how they all work together based off of the information we went through in the groups. So session 6 is a tobacco-free lifestyle, living the dream. At this point, we should see a significant reduction in, the hope is to see a significant reduction in their tobacco use, as well as towards their quitting. We may have some people who have already quit at this point. So we implement lapse and relapse prevention in this session, making sure that we equip them with strategies to help them prevent relapsing and or identifying their high-risk triggers and barriers that cause them to possibly want to relapse. And relapse and lapse could be anything from, if we're at this point and they have a huge reduction in use but haven't quit, we will still consider, you know, the increase in use as part of a lapse or relapse. So we just want to make sure that we put things in place so that since this is the last group, that they can leave going, knowing that they have the skills in place. And then we also have To My Future Self, where we have them write a letter to themselves, talking about this journey that they took on through the Kick-Ass groups and how successful it was for them. And again, they can look at this letter at any time when they have urges or want to relapse or have a relapse. So as you see, there are 2 bonus sessions, bonus session A and bonus session B. The groups are open-ended groups. So that means at any group, if I'm running groups and I'm on group 3 and I get a new participant in, that participant is welcome to join. You don't have to have each group in order to understand what's happening in the current group. But we do, because of that, participants can repeat any part of the group or all of the group. So if we have somebody who went through all 6 sessions and yet they've had a good reduction, but haven't quit and feel like they need support, they can repeat all 6 groups if they choose. And they can do that as many times as they need. So we put in place these bonus sessions that facilitators can bring in place if the need promotes it. So basically, from Journey to Lifestyle, session A would be if we have someone who has gone through all the groups, probably even multiple times, and they have mastered the groups pretty much. The facilitator knows them well. They participate heavily in the groups, but they're still coming and they're still, you know, wanting to participate. Then the group dynamic can change where the facilitator will actually take that participant and have that participant assist in running the groups, just to build some confidence in this participant, kind of let the participant know, like, you've got this, you can do this. So that's a session that's in place. And then session B is addressing the relapse group. So if someone has relapsed, but they have gone through the groups even multiple times, but they had a relapse, we will change this. So if I'm on session 3 and I'm running this group and I have a participant come back, then I will change to session 6 and again, go through relapse prevention. So the curriculum is built for the facilitators to kind of manipulate in a way where they can actually meet the participants where they are. So I'm going to go back to my slides. Okay, can you see that good?
There's a couple of questions. This might be a good intersection.
Okay.
Take the questions. I'll read it for you. Who would be the ideal staff to run the Kick-Ass group? LCSW, community health workers, nursing, or other?
So currently who we have running groups we have nurses running the groups, we have pharmacists running the groups, we have LCSWs, we have on the DMH side some LMFTs, and we also have in some of our facilities, we have, I'm sorry if you could see that. Can you see that?
I can see your purple screen again.
Oh, okay. Oh, sorry. Oh my goodness.
We just see you now.
Okay. So, so we also have facilitators who are alcohol and drug group facilitators or alcohol and drug counselors as well. So honestly, if you're asking that question, who is the most appropriate, anyone who's trained in the curriculum can and feel confident in running the groups can run these groups.
Okay. Can you tell us more about how participants help facilitate the sessions? I think you did that one, huh?
Yeah, so that's towards the end. Again, that's for participants. Well, honestly, the groups are not actually facilitator run like a classroom necessarily. They don't have to be. Every group we would want the participants to be so heavily involved. So if one participant had a question or we're talking about a certain topic, like the facilitator can present a topic, the members of the group can actually take that and share and kind of assist other participants. One of the goals of the group too is that participants will gain increased social skills and actually build a social network with people who are struggling and going through the same journey as they are. So we do encourage that the participants kind of link together and kind of run the groups necessarily, like quote unquote, run the groups on their own with the facilitator guiding them and providing the topics for them. But what I was talking about in regards to really bringing the participant alongside the facilitator, these are participants who have repeated the groups or have gone through all the groups and feel like the facilitator is confident that they have mastered the groups, and they're not feeling confident in their journey, but they're coming back because they feel like they really need this environment. And so to help build confidence, we'll give them, the facilitator can give them specific roles or an activity to present to the group because they're aware of it and they're familiar with the content.
Okay. How often can a participant attend these groups and how are they referred? I think we did the referral with Luz, but if you want to go over it again.
So the participants can attend as many times as they want. They can repeat them as many times as they need and want. We don't turn anyone away in that sense. So there's no cutoff as far as how often they can, especially if they're still on their journey and attempting to quit. So they're referred. We would like for them to be referred by providers. So if a provider has someone who smokes or comes across someone in that clinic who could benefit from the group, they can refer to that facilitator. And we also have flyers. Again, they can show up at the group if they want. So referred to me is a loose term, but every clinic is different. We also have our study coordinators who are recruiting for the study, and then they refer some of them to the groups as well. Yeah.
Okay. And this last one I'm seeing here, how can we get SUD counselors approved to run groups in treatment? And I've opened it up for Jasmine from the Tobacco Control Program Office. I know that there was a training that was being planned. I don't know if that's happening. I saw some information about another training. Jasmine, would you unmute yourself and help us to understand how people can get skills to become a tobacco cessation specialist or to get training? Or John, you're also able to unmute.
Hey Norma, can you hear me?
Yes.
Hi, this is John. So currently we're putting together a training. It's a training with dimensions for to become a tobacco treatment specialist. So what this training will do, again, they're going to go through the whole education and training and give you the hours, so then you can go out and take the tobacco treatment specialist certification test. But you will also be provided with a certificate from UC of Colorado that you have attended their training. And we're still just getting all the information together. So I will be sending out more information as I get them. But yeah, it's still in the works. I'm hoping to have more information by next week. But yeah, so again, this is a tobacco treatment specialist training conducted by the University of Colorado, with more information to come.
Okay, and this is in Los Angeles. I believe it's the Lung Association or the Cancer Society also does trainings. And maybe up on the website afterwards, we can put some resources where folks can look into getting folks trained, because the more people we have trained to even just get this information, the more support you can be to someone who is attempting to change their smoking behavior. Question, can people who vape attend?
Attend the groups or the training?
yeah, attend the groups and they're not included as part of the study. Dr. Friedman, are you still here? Yeah, folks who vape or
I am here. The study
okay,
allows people that smoke and vape to be in the study. It doesn't, if you only vape, then it doesn't allow, although, you know, I think maybe for future grants and future projects, we would be interested in looking at that.
okay, thank you. Are there plans or trainings to have facilitators run separate LGBT groups, or is this the idea for the groups to be open to anyone?
The groups are open to anyone.
Yeah.
I heard Dr. Hurley earlier this morning saying that he was open to ideas of if we need to implement LGBTQ services separately, but as far as the groups, it's open to everyone.
Okay. Can participants attend the Kick-Ash classes only?
Yes.
Okay.
So is that question, let me just see if I'm clarifying the
Okay.
question. If you're not part of the study, can you still come to the groups? And that answer is yes. You do not have to be a part of the study. Anyone who is a DHS or DMH client can attend the groups.
Okay. Are these groups currently virtual or plans to conduct a virtual group?
I'm going to talk about that on another slide when we get to.
Okay.
I was going to answer the question about this theater again. You could be in the study and also just get the counseling if the the client is not interested in drugs or anything like else. So there's like anybody who you can be in the study. We encourage people to be in the study, even if they're not getting the full range of what we offer.
Okay. And our last question for right now, not a question, but a comment that nurses refer to. Yes, we love our nurses. Thank you.
Everyone, anybody.
Yes. And is the Kick-Ash group manual available? It is not yet. We're still in a beta testing phase as we're going through this, but later on it will be. And some of these other training establishments do have a training manual. Like we kind of modified some of Denver's Dimension training. So there are some resources out there, but ours isn't available yet. We haven't tested it enough. Okay.
Is that all the questions?
Yes.
So I did the content and I kind of did some of the journey as well when I talked about the content. What I had for the journey is that it's a 6-week group, but they can repeat. And as long as they have a need and still are benefiting from the groups, that their journey continues. And then I think that says outcomes, correct? So outcomes. So we have had some success. So the goal of the outcomes is that we will see a significant reduction in tobacco use and or we will see participants quit. So far, we have had people showing a significant reduction even by group 3. And it continues on throughout the groups. And we also have had quite a few participants to actually quit. And I will say that those participants who have quit really benefit from continuing the groups and or continuing contact with the facilitators to kind of help them along and to stay quit in their quit status. So. Oh, I guess I talked about that too soon. So outcomes thus far, support. Again, talking about the support of the facilitators, a lot of the participants report, and this is all report coming from the facilitators, that they seem to enjoy having someone that they can go to and rely on to help them through this journey versus talking to friends or family who tend to give them a hard time about smoking. So the support of the group dynamic with other members as well as the support of the facilitators. And again, I did jump the gun on this. So reduction, we've seen reduction as early as the third group and so forth. And quit, we have quite a few participants who have quit but still stay in contact in some form with the group or the facilitators. So the significance of change and combined treatment works best. And I just wanted to put this through this in here, because studies do show that if there is a smoker who is taking NRTs, nicotine replacement treatment medication, who may be in individual counseling for their depression or anxiety or other mental health concerns, that combining this group could also be beneficial with them. I mean, it is beneficial to them. So again, we may see participants who already are in therapy and receiving individual therapy. Can they come to these groups? Absolutely. And combining the treatment, actually, we see a better outcome of quitting versus having just medication alone, or just, even though that is still effective, it's just a higher significance of change when we combine treatment. So I'm going to talk about the barriers to implementation that we're seeing currently. So recruitment has been a barrier along the way. We are fine-tuning recruitment on a monthly regular basis because, again, I think participants have some difficulty with understanding if the clinic, because we only have the 10 clinics running the groups, how do they know if their clinic that they usually go to or the one that's closest to them is actually offering that group? So we're trying to figure out how to recruit across the county to get people to a group. And consistency, we have participants who will come to the groups and probably come to 3 groups and not stay consistent with that. So we do have, that's a barrier as far as the outcome for that participant will not be as great as one who does attend all the groups. But because the groups are open, if they miss a group in between, that's perfectly fine, because the groups will repeat and they can make up those groups or come if they need to or want to. But we're showing that consistency in groups kind of shows a little bit of a barrier with the dynamic, as well as members come together and then we have people drop off. It doesn't, kind of affects the group a bit. I put COVID-19 as a barrier because of COVID-19 and quarantine, we have moved all of the groups to virtual, but how they're happening is by one-on-one phone calls. As reported by facilitators, those that they are calling are appreciative of the one-on-one help, and they are actively still going through the curriculum on these one-on-one calls. And it's been effective. We've also had participants quit by way of the calls. So that's what the process is now. We have talked about repeatedly how to implement a group dynamic virtually, and we're still in the process of figuring that out, as it seems that quarantine will be expanded longer. We're not sure. So I also want to say with COVID-19, recruitment has been very difficult in getting new participants into even acquiring the one-on-one calls. The goal is, if we can get people recruited, the facilitators will still do the one-on-one calls with them, even though we have had new members come in. It's just not as the recruitment of letting people know, letting the community know that this is an option for them is a little bit more difficult being in quarantine, but we're working it out, and we are discussing it on a regular basis. So a little bit behind the scenes of what's happening. So we have trainings. We provide the Kick-Ash curriculum training bi-monthly. Our next training is actually next month in August, I believe August 18th. Don't quote me on that, but I think that's the date, where we will provide trainings to the facilitators through the curriculum. And as the curriculum is being updated and modified, we do hand out new manuals to the facilitator as we make changes to that. And refreshers, if there are facilitators who are fully trained, have attended the trainings a couple of times even, they can still come to those bi-monthly trainings, and they act as refreshers for them. Recruitment, again, is something that we're constantly being creative and trying to figure out how to let the community know that the groups are here and that they're available to people. And that never ends. We can consistently change and create and develop new ways to recruit. And then ongoing support, I provide a monthly open conference call to all of the facilitators. And the reason for that is so that because they're spread out across the county at different clinics, I think it benefits them to be able to bounce off of each other what one person is doing in the groups and how they're facilitating things and how they're getting people to participate, how they're getting people to engage. They can speak amongst each other and go through, acquire new information, as well as talk about how each clinic or each facilitator is implementing recruitment and how it's done for them so that we can all grow from each other. I guess I'm done. So I know I'm probably super early, am I?
No, you got about 2 minutes. We have one more question.
Okay.
What are the costs to the client for the group series?
The group is completely free. If they are a DHS patient or a DMH client, then the group for them is free.
Okay. All righty then. Well, thank you very much, Tasha. We appreciate you joining us this morning.
Okay.
Go ahead.
Email up just at the end. I know Dr. Hurley did as well, and I think Luce did as well, but just so that for Luce and Brianna, you can contact them for recruitment as well, or referrals to your groups or to the groups, or if you're a participant and aren't sure if your clinic has a group, then you can email the coordinators and they can get you connected with the group.